uh, mostly the people with disabilities.
STEAM as well. The hope is that this peer support call-in series will actually be complemented with a shared site as well. And so we are developing that currently. I don't know if folks are familiar with SharePoint at all, but we will be pulling it together on SharePoint so that there's a space where we can also share documents and flyers and all the wonderful information that you all are doing out in the field. But today, what I'm hoping to do is to just kind of go around the virtual room and hear your name, what organization you're with, and if you would share just a little bit about what you are currently doing at your site around vaccine access, or what you're hoping to do at your site with this grant. And again, just a quick announcement, just so folks know, these applications will be closed August 11th. So if you know folks in your network who are still hoping to apply for it, there are still opportunities. They need to get that in by August 11th. And I'll go ahead and drop a link in the chat to those applications. So if you want to help us share and spread the word, I know that folks would appreciate that. So who would be the brave soul who would like to start us off and just tell us your name and your organization, and what you're currently doing around vaccine access, or what you're hopeful that your center will be doing with this funding?
I'll go first.
Great, thank you.
Which one?
Oh, go ahead, Katie.
Okay, no, it's fine. Go ahead, Courtney.
So my name is Courtney. I work at the Center for the Independence of the Disabled. Successfully been able to host 6 vaccine fairs using our more in the city. Finding sites with permits is a little bit difficult, and getting people to kind of come out because you need some covering. We provided some tenting. So we're kind of sticking to the mobile tented events or vaccine buses in all 5 boroughs. We're choosing a borough twice a month. So we've already done one in each borough.
Katie, can you slow down, please? You don't have to talk so fast. I am deaf. I am using captions. It's been difficult following you. Slow down, please. I beg you.
Thanks, Carl. Sorry, Courtney. Go ahead and continue, please.
No problem. Sorry. Sometimes I do talk a little fast. So also part of what we've been doing is targeted outreach to populations that are underserved, the Black, Brown, and Hispanic populations, and the disabled, specifically those in long-term care facilities who may or may not have free access to care or movement. We've utilized 5 different teams who weren't on this project originally to kind of expand our educational resources. And we're hosting a monthly disability rights and awareness clinic to allot people registration for our mobile vaccine clinics to get vaccinated. But also we're really pushing those other vaccines hard because New Yorkers tend to have insurance issues. Sometimes they have housing issues. So we want to provide all New Yorkers with a little bit of everything. That's it.
Thank you so much, Courtney. I think,
hey, Mary.
Yeah, Dan.
Hey, Mary, this is Dan Kessler. I'm the interim executive director of April, and I want to welcome everybody to today's call. But Courtney, if you could maybe tell us, are you in New York City? So that we all have an idea. If everybody could also tell us where they're from, which center. You told us which center. Is that New York City?
Yeah, so I have 5 locations in each borough in New York City.
Okay.
However, I live in upstate New York, so I make the long travel every day.
Oh, okay.
Thank you. And I apologize. I meant to have Dan introduce himself. He's our executive director interim. And sadly, will be leaving us shortly as we've hired our new ED. But Dan, did you have anything else you wanted to add before we continue on?
No, I just wanted to again just welcome everybody, and I really look forward to hearing all the great work. And Courtney, thanks so much for for sharing what you're doing in New York, and that's pretty exciting. And so yeah, it's and I'm sure we're all going to learn from each other. And I do again appreciate everybody being here today. So Mary, I'll just turn it back to you.
Great. Thank you again, Courtney, so much. I suspect as we get to know each other, we'll start to ask each other in-depth questions and figure out how you're doing all the wonderful work you're doing. I know we had Katie, I think, or was it, or sorry, there was somebody else jumping in when Courtney
Yeah, it was me.
going. Yeah, go ahead, Katie.
It was me. Hi, everyone. I'm Katie Brown. I'm the program manager with Northwest Georgia Center for Independent Living. We serve the 15 counties of Northwest Georgia, but we are based out of Rome, Georgia. So that's where I'm from. And I actually just started about 2 months ago. We recently just got a grant that will help us with the COVID and influenza vaccines. We ourselves are not able to give the vaccines, but we actually, I'm sorry, Carlos, I'm probably speaking too fast, but we actually just started or just made connections with a group called CORE here in Rome. And CORE, they have a mobile vaccine unit. So we are hoping to partner with them and create different events around our area for our 15 counties, especially the rural counties that maybe folks have not gotten to get those vaccines for. We've also, we had ordered 600 COVID tests. So they ended up receiving 6,000 instead of the 600. So we also have that in any of our events that we've had so far, not just vaccine wise, but we've managed to take those as well. But that is one of our main goals right now. We are looking to hire as well community navigators for the grant through the US Aging agency, but the grant, the COVID navigators will work specifically on the COVID and influenza information. So to spread the awareness of the vaccines and really just encourage people to learn more about it if they're not willing to do the vaccines themselves. But I'm open to hearing many suggestions, any ideas as well.
Thank you, Katie.
Yes, ma'am.
I also just wanted to add quickly, this is Mary, that we will make the transcript available after the call for those of you who might be furiously taking notes. I know that can always be helpful so that we can really be present in the moment we are now. I saw Cynthia trying to jump in earlier. Cynthia, would you like to go next?
Yes, ma'am. My name is Cynthia Kerr, and I'm with ARSL here in Austin. It's Austin Resource Center for Independent Living. And we've been, our hope is to get as many arms as we can vaccinated. But right now, it seems like the beginning of our vaccine events, we've already had 8, and they were all successful. The most successful one, we got actually 65 people, but before that, we didn't even get 20 at each of them, but at each of the, of them. But it's just a work in progress, and it's a learning experience, big time. And so I'm in the process of getting out there so that I can get more vaccine events scheduled. We also offer the adult vaccines, and those have been very popular with the people that are coming in. Some of them don't even come in for the COVID shot. They just want to need an adult vaccine. But this has been an awesome program, and I'm glad to be a part of it.
I'd like to piggyback off of that. Cynthia works for us here at ARSL. My name is Don Martinez. I'm one of the deputy directors here at Arsenal. You know, here in Texas, we do it big or go home. Yeah. And right now, what's going on is that Cynthia has been very instrumental at getting this off the floor, you know, into some type of missile and going strongly with it. So we applaud her on what she's actually done. And like she indicated, we had 65 at one of the last strikes that we did, and we're just hoping to move and to continue going further into that. Some of the good things that she's done is she does excellent in outreach. She also has a couple of people that are working with her in our other sites, 3 others, you know, one in Hayes County, one in Williamson County, here in Travis County. And we're just trying to do the best we can to touch all of our areas. So again, I applaud her and I thank her for it very much. We actually stole her from one of the health agencies here in town. So she has the insight to friendships and everything there, camaraderie. So thank you again. And thank you for allowing us to be on this call.
Thank you.
Thank you, Don. This is Mary. I just wanted to add, I'm hearing some buzzwords coming out that I can see us tackling in this peer support group later, such as outreach. I think that could be a whole call in itself, just to hear what everybody is doing. So I see Debbie with your hand raised. Debbie, go ahead, please.
Hi, I'm sorry I joined a little bit late, but I just wanted to let you know, my name is Debbie Stanwood. I'm from the Center for Independent Living in Northwest Florida. We're located in Pensacola, and we serve the 4 most northwest counties of Florida. We haven't actually, we're trying to fill this position because a position to handle this because we are very small and we have not the current staffing infrastructure to do it the way it needs to be done. That being said, we are doing some outreach efforts where we're combining some of our outreach efforts to what we're currently doing. We're getting out, we too have COVID test kits from the national stockpile. So we're giving those out along with COVID vaccination information, the latest information. And we are able to count those in Cumulus already, even though we're not actually, I mean, we had a meeting about that this morning with our particular person, but we can count those outreach efforts as, you know, for the vaccination outreach, even though we don't have a position to pay right now to do that. We're hoping to get somebody on the board by mid-July and get rolling. We already have some interested parties. We have some local community clinics that are run by volunteers, and they're all so happy for us to come over and help them. And also with the Florida Department of Health in the areas of our counties that have clinics. It's ironic, I'm home with COVID right now. So which is a drag, but hopefully I'm on the tail end now. I've turned the corner and we're going back up. But anyway, I just want to say hello and let you know I was here.
Debbie, thank you for sharing that. And I hope that you're feeling better. I'm glad you're on the upswing. Great. Who would like to jump in next? For those just joining, we are saying who we are, our names, organization, where we are, and what we're doing around vaccine access, or what we are hoping to do with this funding. Yeah, Renata, I saw you unmute. Go for it.
So hi everyone. My name is Renata Shepard, and I am the transition advocate for Mounting Horizons Center for Independent Living, and it services Galveston County and its surrounding areas in Texas. Also, and so my co-worker Ashley is also on the call too, so she'll probably lend some comments. We are primarily, the work that we've done so far in vaccine and vaccine access is with COVID and the COVID vaccinations. And during that time, and Ashley, I'm sure will want to add to it, you know, nobody wants to, it was kind of hard, you know, getting people to, you know, to say yes, they wanted to be, or no, they didn't want, it was just kind of, I think, all over the place with the responses we got. But I think and with the outreaches and things that we've done, we were successful in getting some folks maybe that weren't so keen on the idea to move forward with that. Still hoping to move forward with that, but also to move beyond that. Because, we know that COVID is still very relevant, but it's not, as relevant as in the last year or so. So hopefully just to focus on vaccines beyond COVID, and lend whatever assistance we can give to our current and consumers and individuals that are in the community, but also educate them more in the vaccine area as we did with COVID as well. And just hoping to be successful with that.
Good job.
Great. Thank you, Renata.
I forgot one thing. We also have a transportation service within our organization. So we're also able to transport individuals that are hoping to get vaccinated or needing to do that. We set up the appointments and those things as well. Took care of the legwork for them, so to speak, as much as we could to get them to where they needed to be as far as getting vaccinated.
This is Carlos from Lyft. We are in Montana, and it's a rural setting, and we serve 18 counties. I would like to ask Renata if she could share with us what is the arrangement with US Aging regarding the vehicles you are using for your transportation program.
Sorry, I had to unmute, Carlos. So we already had a transportation service in place, and we have a partnership with TxDOT and are grant funded in that area. And so we were able to transport those individuals if they needed, to the vaccine sites and everything, but we already had our transportation service in place.
Thank
This is
you.
Mary.
Yes,
Renata,
yes, ma'am.
Oh, I was just going to ask, did you guys start that with, was it 5310 funds? Do you know?
I believe so.
Yeah.
I believe so. And yeah.
Yeah, it's
Yeah.
the 5310 program funded I think it's a mix of like directly federal and then also from the Texas Department of Transportation directly.
Wonderful. Seth, go ahead.
Hi, my name is Seth Wells. I'm the executive director of the RISE Center in Beaumont, Texas, and we work very closely actually with ARSL. They help us with our relocation services here in Southeast Texas. Right now, we're actually putting the groundwork together. We have a high vaccine hesitancy, and in our area, we're still trying to combat that with education. But we're really laying the groundwork for, we also have a transportation program, but not through TxDOT. We started a transportation program through CARES Act funding. And once that funding exhausted, we were able to absorb it at a smaller monthly level, but we're still able to incorporate that into a regular service of ours. But we also have partnered with federally funded healthcare centers to help us provide the vaccines, and they have a clinic in each one of our service counties. And we've also partnered with another transportation provider that is an adult daycare center. So they have nurses on staff. So they will also be able to get the vaccines that we need. And they can also, we're going to hope to do some more in-home services for folks. And our first transportation partner is our local Meals on Wheels entity. They have a fleet of wheelchair accessible vehicles, and we've been running that transportation program. So We're using them to get people to vaccines more so than hosting events. But I'm also tapped into the local veteran community here as a Navy veteran, and we host something called stand downs, which is for veterans experiencing homelessness or near homelessness, their families and others in need. And we're hoping our last one for the year is at towards the end of September. So that's going to be our big push to get a large amount of folks vaccinated. And we're hoping also to set up some clinics at our local Salvation Army to address, again, folks experiencing homelessness, people in transition. And we're going to steal Arsel's idea about going to church on Sunday, for sure, and doing that at our local churches. So really, we're trying to get people to their vaccine appointment, and use the resources that providers already have with those. And then, and for those that are uninsured, we can make a separate appointment to get them to our federally funded healthcare centers and then get them vaccinated through that way. So thanks for letting us talk. We appreciate it.
Great. Thank you so much, Seth. Yes, Ashley, feel free to jump in.
Hey y'all, I'm Ashley. I am the lead advocate at Manning Horizons and Renata's coworker. Sorry, my phone's trying to ring. My brain's trying to multitask too much today. So I wanted to talk more about, I guess, the planning part that we're doing right now for the ADVC grant. We're partnering with a local nonprofit that does a lot of social services for our county, which is Galveston County, Texas. St. Vincent's House, and they also have a partnership with an organization called St. Vincent's Hope Clinic that serves uninsured individuals on the island, but also throughout the county. So that's one of our major partnerships to try and expand the reach of just helping people get vaccinated. I think one of the things that we're planning to do, or that we're researching heavily, is how to get funding to help cover the cost of the vaccines, because right now the COVID vaccine is free, but the other ones are not if you're not insured. And a lot of the people that are in our area that would probably be willing to get vaccinated, period, don't have insurance. So that is a major barrier for them. We're also trying to look into ways to connect with other communities in our county that speak English as a second language. We have marketing and stuff in Spanish, but the third most spoken language in our area is Vietnamese. And there also is a Korean presence in the area. So we're researching our options and finding those partner organizations where we can really help people connect with those resources, or even if they just need help scheduling or getting to the vaccination sites, the access when it comes to having providers or stuff have materials in other languages besides just English is a challenge, I think, in our area. So we're trying to remove barriers where we can. Anyways, thanks.
Ashley, thank you for sharing that. Making notes, I'm imagining all these tools on for the future about things like, outreach, covering costs, finding out what others are doing. Let's go to Adriana.
Hey, thank you so much for having me. I'm Adriana Hartwig, and I'm the program manager with Able Center for Independent Living. We're the SIL in Odessa. That's in West Texas, and we serve 14 counties. We actually had the DVAO grant. So we're using this new grant to just kind of continue what we were already doing while taking on now being able to help with the flu and other vaccines, which is awesome. We have had a lot of resistance in the area of Texas that we live in. So a big part of ours is education, as much as we possibly can. So we're targeting our outreach to most of our areas rural, actually. So we do as much outreach to those outlying counties as we can. And then we have a big emphasis on transportation, helping pay for the transportation, partnering. We do have 2 public transportation services in the area, but it's not a lot for the community that we have. So we're just trying to utilize whatever we can to help people get to the clinics, to the pharmacies, and continue to do what we were doing.
Thank you so much for sharing that. Let's hear from Pamela.
Hello, I am Pamela Ware. I am with Panhandle Independent Living Center in Amarillo. We are in the Panhandle of Texas. We serve the top 26 counties. Many of our communities that we service are under 5,000 people. So we are very, very rural. Very recently, Ochiltree is home to Perryton, and they were struck by a pretty massive tornado. And so a lot of our efforts have now kind of that we're a little bit on pause just to where we can get that community, make sure that all of our services and our consumers in that area are taken care of. But our plans are to go ahead and have multiple events in all of the quadrants of the Panhandle. Overall, it's about 28,000 square miles. So it's a lot of travel to kind of set some of those things up. We have already identified some partners that we can partner with. We're looking for some transportation options that are in those very, very rural communities to get them into the clinics. There is, just like across the rest of Texas, Texans are very hesitant whenever it comes to our vaccines. And so we are doing a lot of educational things right now, trying to kind of combat some of that misinformation that has been out there. And then we have hired a position to help us kind of fulfill the U.S. Aging Grant. I have somebody who recently started last month in May, and so she is working about part-time on this grant to help us pull off these clinics. And so that's kind of what we're doing here in our area. Our plan is to not only have clinics in what we consider our larger communities, which are about 8,000 to 10,000 people, but also to have some in some of those really small communities, in one central small community to where we could do the transportation and get everybody into a clinic, whether we're making multiple trips or having to do some kind of stipend to where they can cover some gas costs. Trying to identify communities with a gas station is a little bit of a challenge up here sometimes, because some of those are so small. And then just mostly doing a lot of outreach through social media. The one thing that the pandemic did do was make it to where people are more reliant on some social media, on some different types of outreach versus just like mail outs. And so now that people are starting to get back into their communities, making sure that we have flyers of upcoming clinics that we're hosting and where they are and how to access any transportation needs that they may have.
Wonderful. Thank you, Pamela. So I think there's just a few more folks we haven't got to meet yet. Yeah, LaDonna, go for it.
Hi, my name is LaDonna Williams. I'm the Executive Director for Rural Advocates for Independent Living. We are located in Kirksville, Missouri, which is in further northeast Missouri. We're about 30 minutes from the Iowa line and about an hour from Illinois. We cover 10 counties in northeast Missouri, so we have quite a large area. It's also all rural. So we have just hired someone. I have Jackie Parrish, who is on, and she's with our center as well. And so we are partnering with our local AAA and with the Senate Bill 40 and working with Meals on Wheels, and just started getting things lined up and getting some training done before we head out to start all of our good things.
Thank you. Jackie, did you have anything you wanted to add? Oh, you might be muted.
There.
Oh, there
Not
you
at this
go.
time. I just started. So
Well, welcome. Great. Who else would like to share?
Hey, this is Tom Olin. We're covering I'm out of Williamsport, and we're covering about 30 more, 30 or actually 34 counties up here. So we're just starting also. We're hoping to do a mobile unit because we have so many counties. So it's part of it is mapping, you know, of not only where, but who. And we're also trying, like some of you, trying to get the our disability marginalized communities, you know, our group homes, our nursing facilities, those who are under guardianship, you know. And so one of the, we're hoping to work with maybe FEMA. You know, we have a state disability disaster integration. Some of you might have also, and they're also, you know, looking at marginalized communities too. So we might, you know, kind of be able to find out where and how. There's also, hopefully we'll use new census data that just came out. That might be a really good thing for us, a lot of us in rural communities, to see where we are at in those communities. We have the Department of Health is something else that we're going to be working with. Partnering with some of the state people is also might be, we're hoping to be able to use their media also outlets and work together, and also not only just the you know, we're also, you know, with the vaccines, but also, you know, in disasters, tetanus shots, you know, other vaccines, other things that can happen, you know. So we might partner with them actually on the, you know, at a fair, and that also, you know, we're also thinking about diabetes. That's something that, you know, is overlooked in some of our marginalized communities. But those are the things. We're just starting. We're also looking ahead at the August. It looks like there might be another booster in August or in the fall. So, you know, we have to think about that. Someone talked about, you know, who's going to pay for it now. CMS just came out with some rulings or in a letter in a fact sheet that you can look at for Medicaid adult vaccine coverage. That just came out today. So thank you.
So as Carlos said, we are with Living Independently today and tomorrow. We serve the southern, southeastern 18 counties here in Montana. Right now, we are planning our COVID clinics, which are running starting from September 13th all the way through November 4th. So we have a little bit of time. We are in the process of working with our county health departments, also a local pharmacy that we linked up with to partnership for these mobile clinics. So right now we're doing the outreach phase, talking to people, make sure we get the clinic set up, and then we're going to start a very aggressive outreach plan into our 18 counties. And so that's where we're at.
Thank you both for sharing. Wonderful. Is there anybody else on the call who hasn't yet got to introduce themselves?
I have not yet. My name is Molly Fulmer. I'm the grant manager with Silo, which is the Coalition of Independent Living Options located in West Palm Beach. And we primarily serve Palm Beach County, but also Martin and Brevard, which is actually a very large county in South Florida. It's actually the largest county east of the Mississippi. So we do have a lot of people that we serve. So we have had this grant for a couple months now, and we have partnered with 2 community health centers. One's actually located at the local hospital, and then another is further south down in Boynton Beach that's really serving the uninsured population, which is primarily Hispanic and Haitian Creole. So that is what we've been doing so far, and we have successfully vaccinated over 200 individuals so far against COVID, which we're very happy about. In the fall, we will then start offering the flu vaccine and hoping to get a couple hundred more people that way. Since with COVID, we thought a lot of people had already been vaccinated or wouldn't want it, but so we're very happy to get a lot of first time and boosters through this program. And at this time, we're really looking at manufacturers to get our vaccines covered. We did find some through Pfizer and also GSK, because we're trying to get the shingles vaccine to people, because it is a very, very expensive vaccine that's very necessary for an older population. So we've been reaching out to manufacturers to get that cost covered. And we are also going to start a mobile outreach very soon as well. Probably in the fall, that'll start.
Wow, thank you. Thanks for sharing. Did we have anybody else that needs to go? Scrolling through my list, I think we may have heard from everybody.
Mary?
Well, yeah.
This is Dan. I think we have some great representation from across the country. And we've also heard from a large number of centers in Texas. We know that in some states, I know Jennifer can maybe tell us about this, there's still some states where there have been no applicants. And I kind of like to know what's in your secret sauce there in Texas, where you got so many centers to sort of come together to work on this project, and maybe how we might be able to learn from that.
This is Renata, and I'll go first. I won't speak for everyone in Texas, and I'm sure Ashley will add to what I say. I know one thing that really drives us is just our passion for it. I mean, we just see that, and I know I'm speaking for Ashley and myself for sure. We are really passionate about it. Not saying that the other centers are not, but we just saw like a really crucial need for it, both within some of the consumers that we serve, and just being out in the community and listening to folks and, hearing what their needs are. Why won't they get vaccinated? What are the reasons? And just trying to address those issues or the needs that they have, so that if they're wanting to get vaccinated, to try to provide provisions for that, or whatever assistance they need for that. But we're just, we do everything big in Texas, they say, but I mean, we're just really I have a heart for both youth and seniors alike. And so, and Ashley, I think she's even more passionate as I am. And so I think that's one thing that drives us, is that we see a need for something, and we get out there and see what we can do to address that. So, but I'll let her elaborate on that if she'd like to do so. But I think that's one of the biggest things, is that you see a need out there, and you hear the stories are just really what tug at me a lot of times. Just hearing the stories and the whys and to what the folks are actually needing. So
I think piggybacking off of Renata, just looking at our county, because we also had the DVAOC grant. I heard someone mention that, and I was doing a lot of research on the demographic data, or who was most affected by catching COVID and things in our area. Our area is very fragmented. We're out of the Houston Metroplex, but we have a lot of rural parts of our county mixed in with the metropolitan areas. Our transportation network is extremely broken. So a lot of people become very isolated and stuck in the home, even prior to the pandemic, and it got worse. So we're seeing a sharp increase in mental health concerns amongst our young adults, especially. Our transportation service heavily serves dialysis patients who are at high risk of complications from COVID, and we had consumers die not far into the pandemic. So I think for us, especially because we're a small crew and a lot of us, use our transportation. A lot of I don't drive because my disability, so I've ridden with a lot of our dialysis patients and stuff just to get to work, or previous jobs I had as a customer before I became employed. And so it became personal just because we ourselves had experienced the health disparities in our county. And we know it's so much worse than even what residents like ourselves had experienced. And we're just seeing that intersection of issues with like housing and transportation and different things adding a burden on the population. And so trying to just chip in where we can to maybe improve health outcomes at the very least.
Great. Thank you. Thanks for sharing. We do hear a lot from Texas, and I'm excited that we've got a lot of folks serving a lot of rural areas, which is, I think, really exciting.
This is Adriana. Oh, I'm so sorry.
Go ahead, Adriana.
I had a question. I had heard a couple of different people mention that they had got COVID tests that they were able to hand out at their clinics, and I wasn't sure. Is that something we can do with this grant, or how are y'all doing it? I'm really interested in information for that.
Wonderful. Thanks for kicking us off to the questions portions. Who would like to share? Where are you getting your COVID tests?
I'm gonna shut up in a second, y'all. Oops, sorry. Go ahead, Katie. Go ahead.
I'm sorry. I was just gonna say, that part, I'm not actually sure. I can find out real quick. But that actually happened before my time with them. So let me run and ask real quick. And in the meantime, Ashley, you go ahead.
Okay. So I know we had gotten some COVID tests that we were passing at outreaches, and what we did is we used oh Lord, I'm gonna forget the technical term. So it's funding that's not tied up in a grant, y'all. So we're a contractor for Texas Workforce Commission. And so those funds can be used, applied to any of our programs. They're not, so that was something that we were able to use to purchase COVID tests. And I cannot remember what that funding title is called. Renata, you might remember, but I can't remember. It's been a day, y'all.
That's okay. I'm also wondering, Jennifer, not to put you on the spot, do you know, is the National Stockpile still handing out tests, or are we done with that?
My understanding is they are. Oh, sorry. Please
That's
go
okay.
ahead.
I was just hoping to hear the same thing. I'm sorry. Go ahead.
Yeah. And I actually just emailed Dan, and I'm sure Dan probably share it with you, the latest letter that I have regarding the National Stockpile. And there's shockingly a process to go through. So I would advise getting started early. They did when I emailed for more information. It took a while to get even more information, and the end result was they said, oh, it's going to take a while, but we're still handing them out. We still have some. Apparently there's an expiration date on them that is not correct. They've actually been extended. I can't off the top of my head remember exactly what the expiration date is and what it's been extended to, but don't throw away expired COVID tests because they have been extended, and I'm happy to find that information out if somebody doesn't know. But I sent the letter to Dan. So if you want to get COVID tests from the National Stockpile, fill out this form. There's very detailed instructions. They will likely take a while. I would imagine at least in the months category versus weeks, hopefully not years. But I can't make promises on their behalf. But I do know also, I think the minimum, and it might be in that letter I sent you, Dan, is 800. So be sure that if you do order them, that you have storage space, because sorry, I'm pulling it up now. I'm kind of reading. And the letter I sent to him is dated way back in 2022, but it's still the same survey and thing. So, oh, there we go. So the minimum order is 800. There is no maximum. So you just want to make sure that you have sufficient storage. And because the tests do need to be stored at room temperature. So, but Dan, if you don't mind, forwarding that on to.
Yeah, I just sent that on to Mary, so I'm trying to find a way to, did you get that, Mary? If you could drop
I
that.
got it. I will
Yeah,
go ahead and drop it in the chat, and then we will also, I'll have Sierra send it out to the registrant list as well with
Awesome,
the notes.
And if I get
Wonderful.
anything updated beyond that I can share, I certainly will. And we would love to know what your experience is with that. I mean, we do give feedback, we have calls with ACL bi-monthly, and we bring back issues that seem to be recurring and things with all of our grantees, and this is one that gets asked a lot. So I'd love to know your experience, and if you end up getting them, or if you don't, or if someone responds or doesn't, all of that feedback's really helpful.
Great. Thanks, Jennifer. Let's go to Debbie and then Katie.
I was just going to share what little I know about that stockpile that's it's administered through the Administration for Strategic Preparedness and Response, and they have a portal that you have to sign up through, and you can make your orders. Now I know that they have completely revamped their system, because when they first started, they had one system, and then they spent months and months and months trying to redo their system. For somebody small like us, it's not as complicated as it is for some of the other providers that are way bigger and under different umbrellas and got people underneath like pharmacies and stuff like that. So but we haven't done the first bit of, we've done 2 orders of 800, and we haven't done the first bit of reporting yet, because they just launched the new system like last week or week before last, in the last couple of weeks. So not hard to do at all. It's very easy. You just get in there and order what you need. And now the proof will be in the pudding when I have to do the reporting, but I don't think it's going to be that complicated. Didn't seem like it's going to. I'm sorry, I've got somebody giggling in the background. But as far as the expiration dates, they give you instructions on how to, well, what we did, we actually had somebody who is ex-Navy corpsman on our staff, and he knew exactly what to do. He printed the labels, and we just put labels on them with the information about the date, and it's the official information that you can get from whoever has that information. So there's an actual website you can go to, and I'm sorry that I can't speak intelligently about that, but you can get that information in the Health Partner Order Portal, and they call it HPOP, HPOP. And that's because it's just a mouthful to say it the other way. That's what I know.
Great. Thank you so much. I did go ahead and drop in the chat both the PDF letter itself and then just a link to the actual pre-registration ACL link that you can fill out. And then we'll make sure we send that as follow-up. Yeah, Katie, go for it.
Well, I was just going to respond about how they got that. It was actually a grant that someone that worked here before me had applied for. So I'm not much help in that way, but I did, going off of what Jennifer was talking about for the expiration date, we did have to look at that. And I believe, if I'm not mistaken, it was for next year. So they were 2 years old. I think though I'm sorry, not 2 years old, but the expiration date goes out 2 years. I'm sorry. But on the box, it was for 2022. So on the box, it says 2022, but on the inside of the test, it says 2024 is all.
Thank you, Katie. That's really good, I think, for folks to know.
I just wanted to comment, if I can jump right in. I just clicked this SurveyMonkey link where you can do the pre-registration on the ACL website, and that's exactly how we got started.
Great, thank you.
And then they will contact you and they'll send you information on how to set up your account, and it's like I said, it's pretty simple. And they will ship. Now you have to be careful because somebody said, I heard somebody say they got 6,000 tests. That can happen very easily because each box has 4 tests. And if you're not careful about what you do, you end up getting 4 times as many tests as you mean to. If you don't have storage, that can be a problem.
These are really great tips. I'm excited. I think that this is the kind of information we're hoping to continue to share within this group. With community, we are stronger. So getting lots of information shared. We have enough time for maybe one more question. And then I just wanted to add, if you want to email myself or my colleague, and I'll put our emails in the chat. If you have information you're hoping these calls will cover. So for example, what are some barriers you're experiencing? What are some questions you're hoping your peers can address or that we can help come up with resources for? I think that would be really helpful so that we can make sure I know this technical assistance remains relevant for all of you. So I think we have a time for one more question. Does anybody have a question for the group they were hoping folks could help them brainstorm around? If not, that's okay too. Lots of information to digest, I think, today, hearing what everybody's doing. Jennifer, did you have any announcements you wanted to make?
I was just going to offer, if anyone's interested, I'm really happy to share a slide that shows the map of the states not covered. Happy to do that, and really anything that any of y'all ever need. This has been amazingly helpful to me. I really appreciate being able to listen in. But if there is anything you need, I mean, we really are happy to share whatever we can, but we're learning as much, from you as you're probably getting from us. So really appreciate it.
Yeah. Jennifer, maybe everybody already knows about it, but the office hours that you're having, could you say a little bit about that?
Yeah, happy to. So we hold just an open, a lot like this, open to any and all grantees. Office hours here at US Aging. It's on Fridays, every Friday at 11 a.m. Eastern. It goes for 1 hour. I try to bring in a national partner to speak. This Friday will be ILRU, will be our speaker. All of the sessions are recorded though, so if you missed one, we can go back and send it to you. We had, the assistive technology folks come in. We've had Sage, all kinds of really great partners that we schedule. And then it's a lot like this, but it's open to everyone. So it's kind of nice. You kind of hear what everybody's doing across the aging, disabilities, rural, urban, and hoping we can do just this. Usually right now, I think we're averaging about 50 people on the call, but we're really getting to know each other, and it's really, we're forming a really great group, I think. So it's nice to see some familiar names here too from our office hours on Friday. So please, if you don't have the invite to that and you would like one, I'm very happy to get it to you. And I'll drop my name in here too.
Wonderful. Thank you, Jennifer. I guess,
Jennifer had a slide. Jennifer, you're going to share something?
Oh, I can if you want me to share it right now, if it's helpful.
Yeah,
I'm happy to just kind of, if y'all want to, I can't share yet, but
hold on.
Can you let me share real fast, and I'll just and I can email you. I just didn't.
Okay, yeah.
You should be able to. Go ahead and try.
Let me just find it. Oh gosh, I have
a couple more minutes.
Okay, let me just find it. There it is. Can y'all see that there? Let me see if I can make it a little bit bigger.
There it is.
Is that all right? If y'all tracking that, I get the whole slide deck here.
Yeah.
I'm bring up some things. So anyway, kind of that middle part of the country, we do have a few applications still pending from in some of these places, but we're still looking to get grantees in these areas, and we do still have funding. I think it was mentioned earlier, the funding date we're anticipate, will close August 11th. Of course, if funding runs out before then, we'll let everyone know. But we do think we have enough, to continue to accept applications until the 11th, but really want to be locked up by the time the flu season gets here. Yeah. So those are the states, and I'm happy to send y'all that too, and Dan, and you can get out to wherever you need to.
Right.
So encourage, if you know someone anywhere really, well, we'd love to have more grantees. But really in these states, it's we'd love to have some color on those states.
Mhm. Thanks for sharing that, Jennifer.
Wonderful. And Seth is wondering if anybody is going to Nickel in next month. Might be an opportunity for grantees to see each other face to face. And then also I dropped in the chat a link. The April conference registration just opened and we are going to be in California in October. So we'll make sure to create a space for folks to maybe mingle and meet and greet while they're at the April conference as well. I think that's a great opportunity to see people in person and hear how you're doing and get ideas from each other. I guess with that, I might end up closing the call out. So I know it's at the top of the hour, but I just really appreciate everybody being willing to share. And please continue to join these calls. Is going to be a series again. We'll do it every month. If you are unable to make the call, feel free to register anyways. And we send follow-up materials afterwards to registrants. So transcript, any resources from the chat. And then eventually we'll have our own really neat portal, hopefully in the next month or so, where we are getting training as we speak to learn how to do that better. And if you ever have questions or if you have ideas on what you would like to see us cover in these calls, please feel free to email those emails in the chat, mwillard@april-rural.org or sroyster@april-rural.org. And we're really looking forward to getting to know you all better and good luck out there. Thank you.